So a woman is born with their cohort of eggs that she will have for a lifetime.
Also commendable for women who want to prioritize their career and who have the opportunity to family plan.
Doctors Hospital's reimagined primary care. We have invested to improve our health system, ensuring that accessible, affordable, world-class clinical care is closer to you. Your relationship with a primary care provider shapes the foundation of your overall health. Our new, modern primary care facilities are where critical diagnosis and true personalized treatment begin. With locations in Freeport and 8 Mile Rock, we invite you to experience the Doctors Hospital difference. Book your next appointment at clinics.doctorshos.com.
Welcome to the Doctors Hospital podcast, where we connect public health issues to what we do here in the Doctors Hospital Health System. I'm Sydney Smith, Director of Marketing at Doctors Hospital, and today I'm super duper excited to welcome Dr. Dorita Francis-Phillips, who's our obstetrician gynecologist here at Doctors Hospital, and she's here to help us unpack the important and sometimes misunderstood topic of family planning. So today we really want to explore the role physicians play in helping women to understand their options while making informed choices about their reproductive health. Dr. Francis-Phillips, welcome.
Thank you for having me.
And thank you so much for being here. I know that you have an incredibly busy schedule, and so we just want to thank you again for coming on the podcast and really helping to inform our audience. So I want to start today by introducing family planning. What is family planning and why is it so important for women's health and future choices?
So, Sydney, thank you very much for having me to discuss family planning, a topic that is that I feel passionately about. It is an important aspect of women's reproductive health. So what is family planning? Family planning basically is the idea of giving women choices about their reproductive health. So those choices may pertain to whether or not they want to have children, allowing them to plan the right time to have those children, given considerations to the number of children as well. And also it's important to take into consideration the spacing for those pregnancies.
Wow. That's incredible. In your practice, can you tell the audience about the relationship between birth intervals and pregnancy-related health risks for women?
Okay, so studies have shown that appropriate intervals, inter-pregnancy intervals, can significantly contribute to healthy outcomes for both mother and infants. And so having family planning options can provide women with adequate spacing. So there are certain complications that can occur, particularly if pregnancies are very close together, depending on aspects of that pregnancy or prior pregnancy, as it may have related to even cesarean delivery. So there are time factors as to how safe it is for your next delivery. We also know that shorter pregnancy intervals can contribute to things such as anemia, iron deficiency anemia, which can have tremendous effects on a person throughout pregnancy and even for women throughout their lifestyle. So having adequate spacing will improve an overall health aspect for a woman's life.
Okay. So in instances where women want to understand about their bodies in order to practice natural family planning effectively, what do they need to know?
So natural family planning, I think my personal opinion, is one of the most difficult aspects of family planning. And that is very individually based. So if you're someone that is seeking natural family planning for be it religious or personal reasons, you have to understand your actual reproductive cycle. And it's very difficult to explain, but the first step is understanding their own menstrual cycle. So menstrual cycle is a woman, as we refer to it locally, is a woman's health that you should see monthly. The average length of a menstrual cycle may be 28 to 30 days. However, there are variations. So some women may have shorter menstrual cycles, some may have longer. And it may also be influenced by underlying medical conditions. Things such as PCOS can also alter that menstrual cycle. So we also understand that in a perfect world, in a perfect scenario, if you have a 28-day cycle, then the average time for ovulation will be mid-cycle, so day 14. And that is the time in which a person is likely to conceive. So in order for pregnancy, we need ovulation. Mm-hmm. So if someone is ovulating, then you know those are the times that you're most likely to conceive, either day before to a day or two after. So if someone is practicing natural family planning, then they need to be aware of those days of ovulation and the most fertile times. Having said that, that can vary, and it is not an exact science for some people, most persons. So my advice would be, one, to utilize modalities such as the Flow app, where you can actually plot your menstrual history. So it entails a lot of involvement. Plot your days between the start of the last cycle to the start of the beginning of the next cycle, and do those for a few months before you actually engage in natural family planning. And if you're avoiding pregnancy, then the times of ovulation may be the time to avoid being intimate with your partner. Now, having said that, it is no exact science, and so it's probably the least effective method of birth control.
Right. So tell us, what are the symptoms of ovulation, and how does a woman know when they're ovulating to be able to identify that?
Okay, so some persons may have a slight discomfort in the abdomen, maybe a little bit of cramps that they may experience on a particular side in the lower abdomen, which may actually signal that the ovulation has occurred. Some persons may actually have breast tenderness or a little bit of nausea around that time. The discharge may vary, but typically it may be more breast tenderness or a little bit of abdominal discomfort. For some women, they may find that their emotions are a bit different at that time. So they're a little bit more emotional, they're a little bit more sensitive, they're easy to cry. They may be a little bit more upset than the average time. And so usually those are some of the simple ways that you can tell.
Right. And I know, a lot of women have experiences with irregular cycles, and some women, they just go to Dr. Google. But I want to understand from you, when should a woman be triggered to go and see their physician if they're experiencing irregular cycles? And when I say irregular cycles, I mean cycles that are longer than the 30 days that's normal, or less than the 28 days.
Okay, so anything that is outside of the norm may require some counseling or consultation with your physician. So the times when you should seek help from your gynecologist or your family physician, basically, if your cycles are prolonged, if you have excessive bleeding, or if there are long periods of time where the cycle is actually absent, or if you've noticed a change in the cycle. So if there's a considerable change in your menstruation, in that you're bleeding for longer days. So anything that's abnormal may mean related to the frequency of your menstruation, the duration of your menstruation. So instead of having a cycle for 5, or in some persons 7 days, you're now bleeding for 10 days, or your cycle has become extremely heavy. So those are times to have a discussion with your physician to see if indeed there's some underlying causes.
Mm-hmm. And in your practice, are there reasons that cycles may be more irregular than other reasons?
Yeah, so there can be various factors that may contribute to your menstruation being a bit irregular. And some of those may just simply be stress. And so those times the changes in your menstruation may just be transient, as in they've been altered just for the duration of that period of stress. Other things that can alter the menstruation would be as it relates to more physical changes in the body. If there are things like uterine fibroids, if a patient has endometriosis, if there are things like polyps. So any structural abnormalities, we have to consider adenomyosis, which is excessive thickening in the uterus itself or the womb. It can cause persons to bleed more. And then you may have persons who have ovarian issues. So you may have just an ovarian cyst that may make the cycle change, or polycystic ovarian syndrome, where the cycles may be for some periods of time absent. And then when you do have a period, they may be excessively heavy.
Well, honestly, this information is so needed. And I think this is going to be really interesting. But for women who don't have irregular periods, is natural family planning still a viable option for them?
That's a good question. For women who have regular cycles, that may be something that they can attempt. For personal choices, yes. If they absolutely refuse, or in some instances due to medical conditions, then it's a possible, it's a viable choice. But we just have to understand that it is not the most, what is the word I'm looking for? It's not the most effective.
Understood. So moving on to making informed decisions as a woman who is looking to family plan. Everyone's talking about the right time to have children, and medically, does that really exist? Or is it more about what's right for each person's unique situation?
That is a very deep question. And I would say openly, or just frankly, there's actually not a particular right time to begin a family. It's typically individually based. However, we do know that scientifically, the reproductive lifestyle of a woman is defined. So a woman is born with their cohort of eggs that she will have for a lifetime. And those amount of eggs, or the quality of her eggs, will diminish as the woman ages. And so the women tend to be the most fertile in their sort of mid to late 20s and up to the mid 30s. There are significant changes in the reproductive capacity after a woman attains the age of 35. So we see a significant decline. For instance, the reproductive abilities may be about at least 18%, 18 to 20% for a young woman in her early 20s, 25. And that decreases to about 12% in the early 30s and may significantly fall to about 7% after the age of 35. Now, we know that science is growing, and we know that there are all sort of assisted modalities that we can use nowadays as women choose to prolong or delay their reproductive desires. But so it's difficult to say, and we basically guide women based on their personal endeavors. And so a lot of factors may come into play depending on where the person is at that particular stage of their life. So some women may naturally want to delay their reproductive desires until they are finished with their professional endeavors, or schooling, or whatever the case may be, where some may want to start as early as possible. So there's no set or right time. The time is basically individualized.
Well, when you hear the statistics, I think sometimes it's easy for women to feel a sense of pressure when it comes to, making a decision on what their reproductive desires may be and when they will decide to have children. So I want to understand from you what advice you would give to young women who want to make the most informed decision about their reproductive future, especially if they're unsure on whether, now is the right time, or if they, if they're prolonging for whatever their personal reasons may be to have children.
So I think naturally I would advise them to make that decision based on their priorities, what their goals may be, of course, in discussion with their partner if there is a significant other. because your reason for either having a child at that point or delaying is your personal reason. And so taking into consideration personal goals, relationship preparedness or readiness, financial goals, those are significant things. And so it's an informed decision. And so given the availability of options for family planning versus the timing of a suitable time for fertility and knowing how your fertility goals are, what are the likelihoods of fertility as we age, I think women are allowed to then make an informed decision as it pertains to their own lifestyle. I think that because you also have to bear childbearing versus an unplanned or unwanted pregnancy at that time as well.
Understood. Well, I think for me personally, I think that's something that you really have to be intentional about. So you see, friends, family, they're moving on, they're making decisions. And so, wanting to kind of be mindful of, what the opportunities are, and, making sure that, you don't kind of leave yourself in a predicament where it may become more difficult to have children. So I think having that information is really, really powerful.
Yeah, I think a balance is needed, and everyone basically has to make a decision that is suitable to them. Many times you may have your friends who have already started, and that works perfectly for them, but you may not be at that position at that time to make that decision for yourself.
Right. So just shifting the conversation a little bit into the role of diet and lifestyle. I know as young women, you feel like you can just live the lifestyle that you want to live. But what is the role of, physical health, stress, and diet? What does that play in family planning and long-term outcomes?
Wow, that's a loaded question. A healthy lifestyle, a healthy life is like money in the bank. So you can never go wrong with being healthy. And optimally, we would love for women to be in their best state of health before engaging into a pregnancy. But having said that, achieving a healthy lifestyle, I think, is a journey. It's a journey that most of us are on every day. And so every day it's a decision made to be healthy. And so being healthy can involve whether or not you make certain changes into your diet, moving less away from a lot of sugars and a lot of fast foods, a lot of decreasing your salt, and definitely incorporating physical activity. Now, physical activity basically helps your cardiovascular health. Is going to help release endorphins, basically elevate your moods. And we know also that certain conditions significantly improve with the overall health. So not only does it reduce your risk of cancers, but it's also very helpful in patients, particularly with like PCOS. So we know that excessive weight is not very complementary for fertility. And a lot of times that can actually aid in some infertility issues or hormone irregularities, which can indeed delay fertility. So I always advise my patients even that the smallest change in your overall health or small goals towards achieving health is even better. So yeah.
You mentioned the link between lifestyle and certain conditions like PCOS. So our culture, we have a certain lifestyle that we live. I don't know if it's the food or, just the way that we work or just the lifestyle that we live. How does that affect family planning? And is there some link between, our lifestyle and our culture and conditions?
So yes. I would say definitely the Bahamian lifestyle, we tend to consume a lot of fast foods. We consume a lot of starchy foods. And those things can basically predispose us to obesity. And we know that obesity and insulin resistance plays a vital or central role in conditions like polycystic ovarian syndrome, menstrual irregularities, and then infertility as a sequelae of that. So definitely lifestyle comes into play for all these things. And so for any young lady who is planning for pregnancy, be it immediate or in the very near future, then engaging or begin to basically incorporate changes in your diet to a more plant-based, if possible, in some instances, or decreasing the fast food, decreasing all that fried and fatty foods, definitely will assist. We know that obesity also assists in hormonal irregularities. And so if the hormones are not regular, then that may offset your menstruation, which if there's no menstruation, there's no ovulation, then it's going to be difficult or to conceive. And so a lot of these discussions can be had for women who utilize family planning for the other aspects of family planning. It's not just for an unplanned or unwanted pregnancy, but to plan a pregnancy and for preconception counseling. So during preconception counseling or consultations with your physician, the goal is to identify if there are any risk factors that can adversely affect a pregnancy or pregnancy outcomes. If there are already like chronic conditions such as diabetes, if there's chronic conditions like hypertension, and these things can have an adverse effect on pregnancy, both for mother and for the infant. And so if we can basically incorporate a healthier lifestyle, if we can get a little bit more active, if we can start simply by walking, if we can change our diets a bit and incorporate a little bit more fruits, a little bit more vegetables, decrease the sugars, decrease the salty and the fried foods, and definitely it will have a positive effect on fertility. And we also know that for certain conditions, even a weight loss, particularly as it relates to patients that are obese, a 5% of loss in your body fat can also enhance ovulation. And by enhancing ovulation, naturally, it increases your chances of fertility.
Wow, this is extremely informative. And we actually have a question coming in from one of our producers who is concerned or wants to know more information about family planning. So her concern is wanting to make sure that she's making the right choice. She's a career woman. She's focused on, progressing in her career. And she really wants to understand if she's making the right choice by prolonging family planning or prolonging her decision to reproduce. What do you say to her?
Right. So that is basically something that a lot of women are facing now. So we have moved away from the times when mothers just stayed at home or women stayed at home, took care of home, took care of children. Now women are career-based. We are driven. We are out there. We are professionals. We're teachers. We're lawyers. We're doctors. And so the right time it varies from person to person, and we're goal-oriented. And so I just want to basically say that we rarely said that there's no right time. It's individualized. But if you want to pursue your career, then by all means pursue your career. And there are times when you can have both. So depending on where you are in your life, you have to evaluate where your career is leading you. If you're able to manage a pregnancy, because we're not certain how the pregnancy will go. If you're able to manage a newborn and an infant at home at that stage of your career. And if not, then I think it's also important to set goals as to, how long into your career do you want to wait before having a child? And so other things may come into play. If you are a career-oriented woman, it's okay. Don't feel guilty. Don't feel consumed by guilt because you're driven by your career, because that is also okay. But you can also recognize that having a career may also put you at a different level in terms of your financial stability. And so it's okay to want financial stability for your family. Also, having financial stability may open doors for other things that as a career woman we can have to assist us. So the support at home is also good. Some persons have extended families. You have mothers, you have grandmothers or godparents who can help with caring for a newborn or helping you through as you're still focusing on your career. And also being financially stable may give you other options. You can afford live-in housekeeper, so you can have good assistance along the way. So there are many women now that are professional women, but we're still mothers. And so I think that personal decision based on those factors. So where you are at your career, where you are financially, how far you want to go. I like to write things down. So jot down a plan, give yourself a timeline, and also be cognizant of underlying conditions that you may have. Certain conditions may make fertility a little bit more of a challenge. And so bear that in mind, not waiting too long, and just always keep your age at the forefront. So we don't want to wait until we're too far and then we're not able to produce at all.
Right. Well, unplanned pregnancies are a beautiful thing, and those women are so strong who perhaps did not plan to have a child, but they were able to make adjustments to their lifestyle to, accommodate being a mother and motherhood. And so I think that that's something that is commendable. But I think it's also commendable for women who want to prioritize their career and who have the opportunity to family plan and make sure that they are, putting the best foot forward when they do make the decision to have a child and reproduce. So let's move on to something that I know a lot of people want to know more about, and that's birth control. So what factors influence birth control, and when a woman must decide what is the most suitable option for them?
Okay, good. So the family planning, an aspect, I should say, of family planning entails contraception. Okay, so the contraceptive needs may vary from woman to woman. And so it depends on if there are underlying conditions, if someone just wants cycle regularity. Some person's cycles are erratic. And so a lot of times we can put you on hormonal contraceptives that can regulate the menstruation. So that is one thing that is available. One size does not fit all. There are variations in contraceptions, be it hormonal or non-hormonal. And some persons are not able to use hormonal contraceptives. And so those are some of the things that we have to entail. I like to always get a little bit of feedback from a patient, and the decision for the suitable contraceptive, I should say, is individualized as well, based on the goals that that person may have, when they would like to conceive, or how long they want to go before conception is available, and of course, underlying medical conditions. And there's simple things that you have to take into account. Some persons are just not good with taking a tablet daily, and they're not going to remember, or their lifestyle is so hectic. They travel a lot. So these are personal things that you have to take into account when you offer a patient various contraceptive methods. And so also, other factors that you want to consider is how effective is the contraception? That's important. So if we're not at the place where we want to conceive, you want the most effective method for you. And so, and also the how long you want to use a method for. So you have contraceptions that are easily reversible, and then we have contraceptions that are long-term but still reversible. And of course, we do have methods that are permanent, and for patients who have already concluded their reproductive desires.
Okay. So tell us about the different methods of contraception, and you spoke about effectiveness. What is the most effective?
Okay, so there are various methods. So contraceptions can be hormonal or non-hormonal. We typically utilize the hormonal pills more commonly. But you have hormonal injections. Those can be either the 1 month shot or one that's given every 3 months. You also have the more long-term contraceptive methods that relates to either an implant that is planted underneath the skin, and those can last for periods of about 3 to 5 years, depending. And then we also have methods that are inserted into the uterus itself, and those are suitable for long-term contraceptives. Now, the long-term contraceptive methods, such as the coils, we have those that are non-hormonal based, the copper T ones that can be utilized for periods of 5 to 10 years, and then the hormonal contraceptive devices like the Mirena. And then the implants, the subdermal implants that basically rest underneath the skin and the arm, those methods or the long-term methods are usually the most effective. So they're associated with about 99% effectiveness. Next in line, I would probably say would be the injections, the 1 month or the 12-week shots, the 3-month shots. And then, of course, the regular birth control pills would be third in line. For it, it's still very effective, but not as effective as the IUCDs or the implants.
Okay. Well, the first thing that I want to know when I go to the physician is it going to hurt? So the IUCDs, the implants, are they painful?
Well, you may feel a bit of discomfort with the IUCDs, but for instance, the implants are inserted, but under a bit of local anesthetic. So you may feel a little pinch for the needle just giving you some local anesthesia. So very little discomfort, to be quite honest with you. The insertion of the IUD, a bit of discomfort, but not significant, no significant pain at all. And there are things that we can do also to make that process more enjoyable and less painful as possible. And it usually is pretty well tolerated. I think patients fear the insertion process more. And once they've engaged in it, they realize that it was nowhere as bad as they previously may have conceived or had previous conceptions about misconceptions. There are things that we can also do to better the encounter or the experience. Sometimes you can just take a mild painkiller just about an hour prior to the procedure. And so ideally it's well tolerated.
Good to know. So women sometimes report side effects from birth control. Which methods typically have the fewest side effects, and how can they find the best match for their needs in terms of the side effects?
Right. So typically, hormonal contraceptions will have more side effects because, of course, we are utilizing hormones. Now, when we say non-hormonal, we think of things like the barrier methods, which are like condoms. So the side effects of a condom is usually very minimal, maybe due to local irritation or reaction to ingredients in the latex or that sort. When we think about the hormonal methods, then some hormonal methods will have both estrogens and progesterones, and some will have just progesterones. Now, there are different side effect profiles that are associated with the different hormones. More commonly for things like the birth control pills that have both, you can have more GI side effects, like sometimes a bit of nausea, depending on when it's taken. Some people can have common things like headaches, even the breast tenderness. Those are some of the simplest side effects. Then there are different side effects even to the progesterone. So typically the progesterone may cause a bit of bloating, a slight weight gain due to water retention. It's not a significant weight gain that sometimes we blame the contraceptive method for, but it may cause a bit of water retention. Progesterone sometimes can be more associated with headaches. So if you have patients who suffer with migraines, then you may want to choose another method or one that has less amount of the hormones. Likewise, progesterones can be associated with things like acne. I find that the copper T, the intrauterine copper device, is probably associated with the least effects monthly because there's no hormones involved. And so those are usually much more tolerated over a longer period of time.
Good.
Now, there are some side effects that are less common, but can be more severe, particularly for some patients who may have predisposing factors to things like blood clots or what we call a DVT or pulmonary embolism. Those are not very common side effects, but they are associated with some of the methods.
Okay. And is there a delay in pregnancy after coming off a long period of using birth control?
That may depend on the method that you used. The longer delays may be associated with a lot of the, let's say, the injectable contraceptives, i.e. the Depo-Proveras, where it may just take a few weeks to a few months to reverse your fertility and back to the back to the state before you would have engaged. So those methods, because they have a longer duration of action, of course, they're long-acting methods. So likewise, they may take a while. And when we say a while to return, we generally will advise patients of about a 3 to 6 month period. The shorter methods, like the birth control pills, you pretty much revert immediately. Likewise, the copper T, once they're removed, then you basically revert to your natural desires right after.
Understood. So this was so informative. But in closing, what advice do you give to women who are interested in family planning? They're just unsure. They may be having infertility issues. What do they need to know?
Okay, so I would say speak with your physician. Book a consultation with your physician immediately, where you can basically have an individualized plan. We can discuss aspects, whether it relates to just preconception, counseling with medications, putting you on your folic acid. We can look at patients who may be struggling already, trying to conceive, but there are difficulties. And so, or persons who may be dealing with infertility and simply just need some support, whether that be a referral for a psychological support team, further investigations. So all these things can be done at a consultation with your gynecologist. So at Doctors Hospital, we have introduced a family planning clinic. And that clinic basically will service both contraceptive needs. So we have a variety of contraceptives available, both the oral contraceptive pills, right down to our long-acting contraceptive methods, the Mirena, the coils, the implants. We also are able to speak with patients who have preconception needs for evaluation. We can also evaluate persons who have fertility or infertility issues. We also have a team of good psychologists on board. We have a dietitian. So all aspects from the family planning to consultations regarding fertility, investigations, and also management for sexually transmitted infections, which can also play a vital role in your fertility endeavors. So we are here to assist you in whatever aspect of your family planning that you may find yourself in, and we can get you through your process easily and comfortably.
Well, Dr. Francis-Phillips, this information is so useful, especially for young women, the career woman, anyone looking to family plan. The information is not easily accessible. It's almost taboo. And so I really want to thank you so much for taking the time out of your schedule to really inform us on all things family planning. Thank you.
Welcome to Doctors Hospital West, your trusted healthcare partner. Our warm and friendly staff ensure a positive start to your visit. Kindly complete this form. Relax in our comfortable waiting area where we prioritize timely care. Our compassionate medical team addresses a range of urgent healthcare needs. We provide on-site lab and imaging services for quick and accurate diagnosis. Your health is our priority, and we're here every day to serve you. To learn more, visit our website or give us a call. Doctors Hospital, trusted and best care now in the West.